Foreign parents order children born in territories where war is ongoing. Infertile patients are much more numerous than we could treat. We have very long queues. Are there boundaries to the desire to have children? Not everyone is willing to have a surrogate mother carry their child. Many try to become parents in infertility treatment clinics. In Austria, 1 in 4 couples faces infertility. You want it so much. Yes. To experience that moment when those coveted 2 stripes appear. An underestimated topic. I have been working on this for about 25 years, and in the last 10 to 15 years, I have had to tell couples, women, and men more and more often, I can't do anything more for you. And at the same time, this topic is taboo. Of course, you're in shock. You don't understand why and what you're doing in an infertility clinic at 29 when you think you're healthy. You feel awful because you blame yourself and can't handle it. When the desire to have children becomes an endurance test, are we becoming more infertile? A child at any cost. How far can the desire to have a child go? And now, we aimed for this. The child is now here and is playing with me. We did it for this. Whether I am a mother or I will become a mother no longer stands, because I am. Come here. Since I can remember, I always knew that one day I wanted to have children. And there was a time when I thought, no, definitely not now. And there was also no suitable partner, and it was clear to me that I had to go through a turbulent phase and everything else, but it was always in my head that I wanted to have children someday. Our child story was probably like every other couple's. Yes, let's have a child. Okay. It is like, let's see it through, and someday we'll get pregnant, and then we'll be a full-fledged family. A beautiful idea, which, unfortunately, did not become our way. At first, a few attempts, a few cycles, you take it as yes, maybe it doesn't work the first time, it doesn't matter, maybe it takes more time. Then you don't think much. But already after 4 to 5 times, you start to think, why isn't there that second stripe? 3/4 of a year. Lela and her husband try to get pregnant, but from the beginning, there is some intuitive feeling that something is wrong. You see a mother with a child. You see a pregnant belly, and of course, you notice a lot of things when you're inside the situation rather than if you say, okay, it's just a stroller. You crave it so much, and the desire to have a child is not quite the right word for this situation. From a certain point, it's a deep longing. You crave it so much. Yes. You dream of those two stripes appearing. Two miscarriages before the 12th week of pregnancy, then a path to the infertility treatment clinic, and the search for why begins. The moment it became clear that it wouldn't happen naturally was so awful. The despair was so great, for me. It also meant finding a culprit. Then I didn't yet know that I was the one to blame, and here should say that many circumstances played a role, which led to the fortunate coincidence that we ended up at the infertility treatment clinic. Genetic testing revealed abnormalities in Lela. She was recommended for infusion therapy. Lela's husband doesn't want to talk on camera about wanting to have children. Together they opt for artificial insemination, also known as IVF. In this process, the woman's eggs are taken and fertilized in a test tube with sperm. The number of patients in reproductive medicine clinics has grown over the past few years. Are men, like women, becoming increasingly infertile? Not. At 25, we are as fertile as we were 30, 50, 60, 70 years ago. It's just the age that has changed. An important detail, we're talking about the female body here. The key point for women is age. It is primarily lifestyle and environment for men. Because the fact remains that the quality of sperm is declining, let's first talk about women. The reproductive doctor has established a preventive program that determines the quality and quantity of eggs with such monitoring as ultrasound and blood tests. Bella also has an appointment today to discuss her test results. We'll talk today about the result we got. I admit I hadn't heard anything about it and frankly hadn't dealt with it because I'm only 28 and focused on my education and career. I was at a preventive examination with Dr. Yust, and he then asked me this stupid question: would you like to have children? And then I started to think about it, thinking to myself, yes. But not now. Yes. The egg does not follow the path of women's emancipation, but it exists, and we need to react to it. If you go through a preventive examination at 25 or no later than 32, then there are many more options that I can offer the patient than when she is 38, and I am forced to say, I'm sorry, I can't help anymore, you don't have any eggs left. A new trend concerning the unfulfilled desire to have children has emerged,